answering questions, giving it information, just being accessible.
My
And so we
brother
are so
was the
grateful
rescuer of the
that
family. He was
you
like
are
the guy
here
that keeps
and just
everything
ready
together.
for your healing.
He was
You
sent
know,
home
that
with the
information
symptoms
and
to self quarantine himself. 5 days later, he ended up going back to the hospital in an ambulance. He was on the ventilator for 2.5 weeks. He didn't survive the disease. It's been very hard. It's day by day, and it's
It's gonna be okay, I promise. It's the African American fear of the government, and it's also the system trying to address all the disparities that we are already facing in St. Louis. You know, my community is where Ferguson happened. So they're already dealing with trauma, they're already dealing with stress.
When you look at these communities and you see that they have higher rates of diabetes, higher rates of asthma, higher rates of obesity, heart disease, cancer, you name it, these underlying risk factors that have been exacerbating death rates in these communities, it's not surprising. These social determinants of health have an underlying political determinant to them. We know that because of the history of this country in experimenting on Black and Brown individuals. And so many of these communities are very fearful. They're distrustful of our healthcare system and of our government. So if we do not take an appreciation for the historical context and for the political determinants, then we're only going to merely nibble around the edges of the problem of inequities.